Our next question is, what are signs of Alzheimer's? I forget simple things, and I'm afraid of it progressing to something more permanent.
And I have some resources I had found that, and there's changes that occur with age, but then there are things beyond that. And so the Alzheimer's Association had a really great list of some signs to look out for if you think that your loved one might be experiencing, or you yourself might. And so some of those were, one of the first things we think about is the memory loss that impacts, and the key here is that impacts daily tasks. So for instance, not remembering recently learned information was a big one. Forgetting important dates, important events, asking the same question over and over, finding challenges in planning or problem solving. So maybe a once familiar recipe that you could have cooked in your sleep all of a sudden becomes really difficult to do. Maybe you're having trouble doing your monthly bills, trouble concentrating, taking longer to do tasks than before. So maybe something you were able to do very quickly now becomes very cumbersome and very difficult. They also mentioned just difficulty in completing familiar tasks. So driving to a familiar locations may become difficult. Confusion with time and place. So people tend to lose track of dates, seasons, like the passage of time, and oftentimes they forget, where they are and how they actually got there. Trouble understanding images and spatial relationships. So we're not talking like cataracts and things that happen with age, but there's trouble with with reading, judging distance, color, and contrast. And so driving can become difficult for these folks. New problems with speaking or writing. So not just forgetting, the right words. I think sometimes we all tend to go, what is that word I'm looking for? But these people really struggle with that, and sometimes have trouble joining or following conversations. You start to misplace things. So it's not just, I think we all are probably guilty of, we lost our phone, our remote, but these folks can't retrace their steps, and they might start to put things in unusual places, and may start actually accusing people of stealing their things. And then it can also lead, another sign is decreased or poor judgment. So maybe you notice that a loved one is not as cautious with money as they once were. Maybe they're giving a lot of money to a telemarketer that just called, not paying attention to their grooming or hygiene, withdrawal from work or social activities, and changes in mood and personality. And so, which can be, as a physician, it can be kind of confusing and, mixed up with the diagnosis of depression. So you really want to probe a bit more. But those are some of the signs I found to be helpful from the Alzheimer's Association. So I'd love to hear, Bill, Dr. Bill, is there anything else you would add to that list?
I think you did a great job. It's really common that people come in to the office and are very worried about this, because as Dr. Jamie said, they're having some forgetfulness or something, and then almost like the more you stress out about it, the worse, it becomes almost like a vicious cycle. But I think what Jamie said was really important to remember, that Alzheimer's is not just memory. Memory can be a part of it, but it's one of those other things that she mentioned that goes along with it. So you're really looking at something else, the language issue, the inability to find a word, the inability to balance your checkbook, some sort of what they call, I think the neurologists call it, a loss of some executive function, the ability to execute, on your life. Now, if you begin to have those things and go in, it's important, as Jamie had said before, to go in and talk to your primary care provider, because they can do a sort of mini cognitive screen to just see if there's enough there to be worried about you. And there is a condition. That's actually a DSM, diagnosis called MCI, or mild cognitive impairment, that may be on the path to leading to full Alzheimer's, but it may not too. So if they can just be aware of you and then watch you along over the months and years to see if anything is progressing, that's pretty important. But I'm glad Jamie said the thing about depression too, because a lot of folks, when their general mental health is not doing as well, will have some of these symptoms. And so you want to make sure that if there's what we call reversible things, sometimes getting you on an antidepressant, sometimes it's your thyroid, sometimes it's B12 or folate. Those don't happen very often, but you would certainly want to make sure if there's a reversible cause of memory problems, let's deal with that before we start assuming it's something else.